just about 10 seconds and we'll be
I'm going to go first so Craig can just keep going. Sorry about that. Multimedia. My name is Suzanne Fageol. I'm from Whidbey Island, Washington at the moment. I have been involved with EFT. Well, I downloaded Gary's videos and stuff like way back when he first put them on the net, but more recently have gotten re-involved. So about 2 years. I'm a certified counselor here in the state of Washington. I wear a lot of different hats. I'm a spiritual director, I'm a cranial psychotherapist, and I'm a somatic trauma educator. So that's the hat that is bringing me here this morning to present with Craig. And that's all I'm going to say right now.
Thanks, Suzanne.
Hi, I'm Dr. Craig Weiner, and let's see, from Whidbey Island. I know many of you. First, I just want a quick thank you for everybody that put this on. All right, so can we give a round of applause to Lyn and the volunteers? And really a thank you to you for being here, because without you, we'd be standing up here by ourselves and it wouldn't be nearly as much fun. So thank you. So my name is Craig Weiner. I'm a chiropractor. I'm an EFT trainer along with my wife Alina Frank, who many of you know, and also specializing in trauma and on a physical level. I'm also using EFT for the past several years. And so I think that's enough about me. We want to get to the work. So let's get started. For today, really the history of how this came together is through EFT, meeting Suzanne, who really specializes in the field of trauma from another perspective, and then developed her interest and her passion and her skills in EFT. And over many discussions and many meals and many mutual interests came an interest in our interest in neurobiology and EFT and working with trauma. And really that's coalesced to a partnership where we're looking to really take this work on the road to be able to teach multiple health professionals, chiropractors, mental health professionals, dentists, physical therapists, anybody that deals with people that have been through trauma, and how to appreciate the depth of both the physical and emotional components of trauma using EFT as a primary modality, but not the only one in working with it. But today's focus really is about the neurobiology of trauma and EFT as an effective way of working with it. So that being said, don't you love, wait a minute, go back. Just in case you missed that, see, EFT can be used at any age. Yeah? Wonderful, yes. All right, let's move on.
Excuse me, I just need a check here. Can you, are some people having trouble seeing through me sitting here? Yes. That's what I thought. All right, so I'm gonna just get
Okay.
back. Is that better?
Yes. Yeah.
Okay.
Great, thank you. Okay, the stress spectrum. So if we use this visual as a scale, we want to talk about stress. Number one, what Lyn spoke to, especially in working in the base, is as volunteers, especially non-mental health care professionals, we want to be careful about our appropriate and inappropriate use of diagnostic terms like PTSD. All right, so we want to be very careful when we use the word stress, and in a stress scale, we're going to have from a level of what's called apathy or lack of emotion. We really are talking about a non-affect, a basic place of neutrality, to a level of stress, which becomes a physiological, emotional. I mean, how many people can't relate to varying levels of stress from a little bit to a lot? And we're talking about the stress spectrum most of the time when we're using EFT. To actually hit a level of trauma, we're then going another level beyond that. And we'll go over a definition of trauma and definition of talking about PTSD. But for most practitioners that are working with EFT, you're primarily working with the stress spectrum and relating to those people that, especially with veterans, when you're as a volunteer, when you're as a non-mental health care professional, you can be talking about traumas, and we're going to talk about a little bit the difference between a small T trauma and a big T trauma. However, we like the idea of it always being a scale from a little bit to a lot. Anything you want to add about that? Okay. All right, response to stress. I know much material. There's a wide variety of experience here in the room. So I still want to cover the basics for those that it's not so familiar with. So with this slide, what we can see is 3 different responses to trauma. Okay? The fight, flight, or freeze responses. Freeze response has been kind of the cousin that hasn't been talked about for a long time, and we'll be talking much more about that. But the 3 physiological responses to a sudden trauma is what we call a fight response, and you can see those cats, right? So they're fighting at each other. So there's movement towards, there's an interactive, there's a physical release along with the release of stress that comes with fight. There is flight, which is still a physiological reaction except in the opposite direction, right? But very equivocal response physiologically with regard to movement, just 180 degrees away. And then we also have harder to see, but basically there's a little mouse there, and it says wrong choice, and he's kind of frozen there like, uh-oh. Okay? Now, what we have to understand with these responses, to give you a story, Peter Levine does a nice one with this that talks about a cheetah and impala, for those of you familiar with the story. But we really just want to understand that physiologically we are still animals, yes? Hi, Joanna, welcome.
Hi, Craig.
Hi. So I want you to just picture for a moment impalas, a group of them grazing, okay, on a savanna, and suddenly a group of cheetahs see them, and obviously the impalas are prey, okay, and so what they're looking for is they're needing food, they're the source of food, and all of a sudden the cheetahs start chasing after, and they start to see a weak one, and they separate it from the herd. And we could see that weaker one all of a sudden is going to fall prey. Well, when that, at first, what's happening to the impalas, what are they doing?
Fleeing.
They're fleeing, right? That response to stress is to basically take the part of the nervous system that needs to get up and go, and it flees hard, until the point that it knows, I ain't getting away. What then starts to kick in is what we call the freeze response. It basically, in a sense, lies down and goes possum. It basically shuts down. And the freeze response happens for several reasons. It shuts down because it'll go into where it'll release endorphins. So it's not going to feel the pain about what's not going to happen. It's also a response, freezing, that also ensures another possibility of survival as far as a mechanism, which means that in response to prey, sometimes what happens is even though when the cheetah catches to it, grabs it, and takes it aside, if it then thinks it's dead, it may leave to go get a rest of its family, and it may just come out of its freeze response, stand up, and be able to take away. And what it does in that response is it shakes off what just happened, and it moves. So we need to understand these distinctions of fighting, of fleeing, and freezing, because we're going to talk about how that has to do with humans, which is slightly different in the way that we tend to do that. Suzanne, anything? Great. You want to take over this part? Okay, so Suzanne's going to talk about some beginning brain development. We call it the triune brain model.
A man named Paul McLean developed this triune brain model, but Dan Siegel, who is also a trauma expert, does a great job of helping people to understand it in a very simple way. So, if everybody would please put up a hand like this, okay, and think of this part of your wrist going into the hand as the brainstem. Now, if you put your thumb across, this is the midbrain. And actually, there should be 2 thumbs across because it actually goes all the way across. But so just imagine you have a long thumb. Okay. Oh, okay, thank you. And now wrap your fingers around the thumb, and this is the neocortex. 5/6 of the human brain is the neocortex, that wraparound. And sometimes when we talk about flipping our lid, what happens? The neocortex goes away, and that's exactly what happens in trauma, and we are unable to do a lot of logical thinking and processing because we do not have the advantage of the neocortex, for the most part, being online. Now, this is a very oversimplistic view of the neuroscience of the brain, but it's the basic it will give you a good idea. So we've got the brainstem, which is the reptilian brain. Reptilian brain is that which is completely everything that's automatic. Our breath, our heartbeat, everything that is subconsciously out of our control, that it just happens automatically. Our breathing, it is innervated through a chain, what's called chain of pearls up the back of the spine, and into the brainstem itself. And so think of a reptile who thinks of hot, cold, that kind of thing, and that's your basic automatic responses. Then we have the midbrain, or the limbic system, which carries a lot of, the two main parts you may have heard of are the amygdala and the hippocampus. And they are responsible for the arousal of danger signals and also memory. And it's called the mammalian brain because all mammals have this part of the brain. Then we get to the neocortex, which, as I said, 5/6 of the human brain, and has what we call the higher functions of consciousness. So, basic model of the brain.
Right. Will you hit the next slide? Sure.
So, the piece with the human brain here is that as infants, we are probably more helpless than any other living being in terms of being able to do anything for ourselves. So when we are first infants, we have to learn how to regulate our nervous system. And we don't know how to do that. So we rely on our primary caregiver to show us how to do this. And the interesting thing about human beings is that we are wired neurologically for connection. We are wired for the interpersonal. And so the way we learn how to regulate is through our caregiver. And that if that caregiver is able to be present to us and to nurture us and to focus on us enough to see that when we're crying we need to be picked up and comforted, or if we're hungry, and as you know, a mother is usually the primary caregiver, but not always. But they learn how to distinguish between a hungry cry or I need my diaper changed or whatever, okay? So that neural regulation, when it's going well, is regulated, it's flowing, it's calm, it's balanced, and it's energized. So when a child is in a play state, that's also a place of neural regulation. Now, unfortunately, only about 40% of us are neurally regulated when we're children. The rest of us all have what it could be commonly called a different kind of attachment to our caregiver. And what that basically means is that we develop patterns of dealing with stress that is an effort for us to get at regulation, but doesn't always work. And so we learn patterns of coping that sometimes are certainly helpful in the moment, but may not be helpful later on in life. And that's where we can begin to get into some issues of non-regulation, because trauma only occurs when regulation is not possible. Okay, let me say that again. Trauma only happens when regulation is not possible. Yes. Could I ask you to write your questions and hold them? We're going to leave a few minutes at the end for that. Okay? Okay.
Do I have anything about mirror neurons with that?
Oh yeah, okay. So one of the ways that the brain helps to do that is what's called through mirror neurons. So for instance, if I smile at you, many of you will just smile back. Thank you, Jenny. And that's what happens when you think of a mother playing with the baby, right? And she's going, goo, 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 and the little baby's like, okay? That's part of the regulation. The whole area of the face, the eyes, the ears, all the senses, and the heart and lungs are all part of the mirror neuron system that helps us learn. So we learn to regulate through the body and through sensation. So, what this looks like in a different way could be called either the optimal arousal zone or the window of tolerance. So for the moment, just look at the middle of the screen at the optimal arousal zone, the green. And that's the zone of safety, being resourced, calm, balanced, flowing. And as we grow, we learn how to widen that window so that we come to tolerate more and more. And so one of the jobs of the infant and the toddler is learning how to tolerate more and more discomfort and regulate it as their world opens up and they're told, like, no, you can't touch that or whatever. They fall down as they start to learn to walk. And the whole idea is to broaden that scope so that everyday occurrences that may leave us temporarily not feeling regulated or calm, our nervous systems are able to expand to the extent that we can re-regulate. So, for instance, the child learns how to be hungry for a few more minutes, or to be able to tolerate a dirty diaper a little bit longer, even though it feels irritating and they're not very happy. And similarly, as we grow through life, we learn how to tolerate the discomfort of people saying no to us, or whatever may happen as an interaction that feels more conflictual. And we learn to be able to widen that window in many cases so that we can come back to a place of calmness. So I might say, well, you know, you yelled at me, but I'm not going to take that personally.
Question, could you define for them what you mean by resourced?
Yes. Resourced means when you are in a state of neural regulation or calmness or flow, balanced nervous system. And so a resource is a way to get back to that state, and we will talk more about resource as we go through this presentation.
Thank you. How are we doing, okay? Good, checking it.
Hey Craig, you think we could turn off some lights, because this one is flickering and it's really...
You know what, somebody turned on the cams. That somebody that knows the light, can you turn off the cam lights? You need the fluorescence, but...
It's the only thing that is keeping you out of shadow for the video effect.
Is that accurate? The cam lights? You know what, I don't know that that's accurate. Can we try turning off the cam lights? Because they were off before.
When these are on a dimmer, when fluorescents are on a dimmer, they flicker. And so they are.
Can we give it a shot?
I think they're on
That would be great.
dimmer.
Either turn it all the way up so it doesn't do that, or...
No, they're not, fluorescents aren't intended to be used with.
There, perfect.
That's how it was
Does that
before.
work for everybody?
Okay,
Cool.
we're good, great, thank you.
Went really easy.
That was easy. Okay.
I know.
All right, so let's talk about the nervous system. All right, as a chiropractor, this is my life. This is what I deal with every day. To make some distinctions and to be able to give you a perspective. Right now we're talking about what we call the autonomic nervous system. Some people refer to it as the automatic nervous system. It makes it easier to remember because many of the functions of what it does happen automatically without conscious thinking. Not saying we can't develop some conscious control over those things, but they tend to work on them on their own. The autonomic nervous system is divided into two halves. The audience participation. Sympathetic, parasympathetic, very good. The sympathetic nervous system, you want to be Dana?
Sure.
Okay. The sympathetic nervous system. On this side, which shows that chain of pearls, which goes up and down the spine and innervates from this side for a moment. On the other side, oh, you know what? I knew you had skills, but now it takes it to a whole nother level. The parasympathetic part of the nervous system is like the yin and the yang. Okay, so let's just speak about that for a moment. They each have their own rheostat dials. They're each working simultaneously. They're each corresponding and involving, especially as we're talking about here, all the viscera, all the internal organs. So liver, stomach, gallbladder, lungs, heart, etc., etc. It goes on and on. Blood vessels. And is very much a part of how we regulate, how we respond. It's what we're really dealing with trauma more than anything. What we need to understand too, can you go back to the previous slide? is that, so I'll say, now, we all know that, and I just want to be clear, that the sympathetic doesn't sit on the right side of the body, and the parasympathetic, that was a diagrammatic model, right? They were overlapped, yes. But for a moment, I'll do this. If we increase the sympathetic nervous system, one way of describing that would be hyperarousal, right? So what does the sympathetic nervous system do? Boom, that cheetah comes running, and all of a sudden the response is, I need to run, I need blood vessels to go to my legs, I don't need to worry about sex or digestion right now, I need to go. Now, eyes wide open, hairs on the back of my neck, blood flow's going to my legs, I don't need to be having blood flow going to my gut to digest the grass I ate. So when, as a human being, we go into the hyperarousal, or the turned way up volume of the sympathetic response, what are some of the things we call it? Sympathetic activation. A lot of these words we're using, so when you start to read the literature and read the Scare and the Siegel and all the great authors we'll talk about, you start to get a little familiar with these terms. Sympathetic activation, it's just that it's turned on, right? Anxiety, anger, fear, increased sensation, hypersensitive, emotional reactive response, hypervigilance, intrusive imagery, disorganized way of not thinking so good, disorganized cognitive processing, right? So all of these things happen when we're in a hyper-aroused response. Blood flow's not flowing to the cortex to, I'm going to contemplate, how should I best respond to that cheetah right now? Yeah, go! Okay? In between, we have that optimal arousal zone, which we're all still working, not just as a child expanding, right? I don't know about you, but I know I'm still working on that. Hypoarousal, well, I would say two different things. The word hypoarousal can be spoken of, or we could call it hyperarousal with a parasympathetic system. Okay? But more commonly, we talk about this as, neutral, really aroused, less than aroused. Is another scale. Under hypoarousal, the parasympathetic system is now turned way up or in overdrive. Freeze response is one we'll definitely be talking about more. Dissociation, we won't go into a lot today, but very important. Gone, disappeared, checked out. Collapse is another one, physical, emotional collapse. Shutdown, absence of sensation, numbing of emotions, disabled thinking, reduced physical movement. Okay, what happened when that apologist went, okay, I'm a goner, shut down. But make it human for a second, okay? So something happens and all of a sudden, you might use the word even though it's not correctly shock, but in a sense you go into a state of shock. It's like, public speaking. What was I going to say? I mean, in a sense, that's a kind of minimized freeze response. Everything's shutting down. I can't think real clearly. I'm not able to process. Okay, let's go forward. Okay, there was a wonderful ad series. We need to, for the Mercedes-Benz, that did a great, lots of imaging regarding what we call hemisphericity, or the right and left brain, and we need to mention this. I'll read some of those. I know you can't read it, and the feeling that it gives. Let's go there first. Okay, right side of the brain, so obviously, right side of the brain, this way. Right side of the brain is that part of our brain, number one, that is really the holder, the generator, the processor of deep emotions, especially held emotions with memory. And we're not going to go a lot into that today, but it's very important with regard to that process. But the right side of the brain is also that part of us that has, it's not so linear, it's a big picture view. It involves the emotions a lot more. It has to do with vision. It has to do with no time. It has to do with creativity and imagination and ability to visualize. All those different aspects are much more right brain-oriented traits, whereas the left brain is much more cognitive, much more linear, much more verbal. And so together, when working, they do a beautiful job of bringing different skills. However, when our brain gets hijacked by trauma and intense emotions, then they're not working so well together, and we'll talk more about that. Here's another good slide that just separates some of the qualities of right and left brain. On the left brain, much higher developed ability to be logical in a situation. Okay? Again, reduced when we're in a hyper-aroused state. Linear, language, math, reading, writing, analysis are very left hemispheric qualities. Right side, a lot of our personality, not all of it, but a lot, creativity, intuition, gut sense of things, music, art, spatial abilities come from the right side. So really, when we talk about, to re-reference what Suzanne was saying earlier, the ability to develop an optimal arousal zone, the ability to resource ourselves in a situation in which we've become hyper-aroused, the ability to calm and re-regulate are all ways to redevelop the ability to integrate these both sides so that they're both able to respond and we're not just in a defense or responsive mode in a situation. Yeah, yeah, please do.
So my add-on would be that not only does trauma come through the right side of the brain, but the right side of the brain is what you work with to release trauma.
Thank you for that. Okay. I love this stuff. My brain just goes, all of a sudden I'm like, okay, I get to talk to Joe Dispenza and interview him next week, and he could go on for like 42 days on this slide, and I get like a minute. Francine Shapiro, the developer of EMDR, quote, neurons that fire together, wire together. It's said by many people in many ways. When we rewire the neural circuits, the adverse physical sensations and reactions are not there anymore. So for those that don't know what this is, okay, this is a synapse. This is where the action is. This is where it all is happening, right? And so we have two nerve endings. We have axon, dendrite. We have the neuronal synapse space. We have all the different neurotransmitters that send messages. Electricity allows the release of the neurochemicals that go across, for which there are receptors continuing the signal, and they're connected. And especially with trauma, with memory tied to emotions, these are very strong connections. What we're looking at with EFT, and we're still understanding the science of how it works, is the ability to allow this to not be such a well-used connection and for it to start to do this. In other words, to break apart a neural connection and to rewire a different response. Okay? And we'll talk more about some of the theories about how that counter-conditioning we're believing is working. But really, in breaking a habit, in breaking a repeated automatic response, we're starting to then create new nerve factors that then say, you know what, as this strength of this connection diminishes and we establish new ones and it gets stronger, we can start to develop new responses to triggers and things that remind us of things that are in the past and are not letting us to be in the present moment. Anything you'd like to add? No? Next. Yeah, go ahead.
So this last decade has been talked about the decade of the brain, and we have learned a great deal about how our brains work, although obviously we're just starting to learn, and the president has decided that it'd be a good thing for us to learn more, so that's good. But one of the things that we learned here is that working through the body is the way to go. That everything, all that neural wiring and rewiring and firing happens initially through motion, and then a sensation, and then an emotion, which might lead to an image. And what happens when we work through the body is, first of all, we have to be in present time. If I ask you to check in and notice what you might be noticing in your chest area, you have to be in present time. You have to stop everything else you're doing and just stop for a minute and focus in present time on, what is that? What do I notice in my big toe? What do I notice in my fingers? You can't be anywhere else. So the first thing we know about this is when you are focused on the sensation, you cannot be in emotional intensity. Let me say that again. When you are focused in present time, you cannot be in emotional intensity. So that's one of the ways that we break that circuit. The second thing we know is that the use of felt sense, and it's just exactly what it sounds like. It's the felt sense of something, and all of us have had that experience one way and another. You know, perhaps some people might call it intuition or whatever, but we just know, no, I don't want to do this. I just know I don't want to do this, or I do want to do something. That's our body's neuroception, that we just know that is what is. And then the third thing that's important is, in order to work through the body, one has to develop what is called witness consciousness. Now, meditators have known this for a very long time, and this is one of the reasons why meditation is also one of the things being brought in to work